What if the burning in your feet at night is not just tired feet, not just age, and not something you should keep ignoring? Many people over 50 feel that hot, stinging pins and needles feeling when they lie down at night, and most of them explain it away. They say, "I was standing too long. My shoes were tight. My feet just get hot. It is probably normal at my age." But here is what most people do not realize. Burning feet at night can sometimes be your body's quiet warning signal. And the strange part is, the real cause is not always inside the foot. Sometimes the cause is simple. Sometimes it is hidden. And sometimes it is something people would never connect to burning feet until the problem becomes much harder to ignore. That is why in today's video, I am going to show you 7 possible causes of burning feet at night, counting down from number 7 all the way to number 1. And please stay with me until number 1. Because number 1 is the cause many older adults ignore the longest, but it is also one of the most important to catch early. My name is Dr. Edward Wright, and after more than 20 years of helping older adults understand symptoms like this, I have learned one thing very clearly. Foot symptoms are rarely random. Your feet can reveal problems long before you fully understand what is happening inside your body. So, before we begin, comment below. Where are you watching from? I read every comment. Now let's begin with cause number 7. Cause number 7, daily habits that irritate your nerves and blood flow. This includes alcohol, smoking, dehydration, poor sleep, and late-night processed foods. Most people do not like hearing this one because they think, "Doctor, I only drink a little at night." Or, "Smoking affects the lungs, not the feet." Or, "I just eat something sweet before bed because it helps me relax." But your feet are not separate from the rest of your body. Your nerves need oxygen, your blood vessels need flexibility, your muscles need hydration, and your body needs stable blood flow while you sleep. If your daily habits keep irritating your nerves, tightening your blood vessels, or disturbing your sleep, your feet may be the place where the warning shows up first. Alcohol can irritate nerve health in some people. Smoking can affect blood vessels and oxygen delivery. Poor sleep can make pain feel louder. And too much sugar or processed food at night can make the body feel inflamed and restless. So for the next 7 nights, pay attention. If you drink alcohol at night, notice whether your feet burn more later. If you smoke, notice whether your feet also feel cold, numb, or heavy. If you eat sugary snacks before bed, notice whether the burning becomes worse when you lie down. This is not about shame, it is about patterns. Tonight, write 1 line in your phone or notebook. What did I eat? Did I drink alcohol? Did I smoke? Did I sleep well? How bad was the burning from 1 to 10? Do this for 7 nights. You may start seeing a pattern you never noticed before. And if a simple habit is making the burning worse, that is good news. Because that means you have something you can begin changing. Because number 6, vitamin and nutrient problems. When people hear this, they often say, "Doctor, I eat enough food." Or, "I take a multivitamin sometimes." But nutrient problems are not always about how much food you eat. Sometimes they are about what your body absorbs. As we get older, absorption can change. Some medications can affect nutrient levels. Some diets are low in key nutrients, and some people go years without checking their blood work. One nutrient doctors often pay attention to with nerve symptoms is vitamin B12. Low B12 can sometimes be connected with tingling, numbness, weakness, balance problems, or burning sensations. But here is the mistake many people make. They hear one thing online, buy a large bottle of supplements, and start taking high doses without testing. That is not the smartest way, because nerve symptoms can have many causes, and random supplements may not fix the real problem. The better step is to ask your doctor if your symptoms need basic blood work. That may include B12, blood sugar, thyroid levels, kidney function, and other common checks. Testing gives you direction. Guessing keeps you stuck. At home, build a better plate. Add protein with meals. Add colorful vegetables. Drink enough water earlier in the day. Reduce processed sugar at night. and do not depend on one miracle vitamin to solve everything. If your doctor finds a real deficiency, correcting it may help. But if your levels are normal, then you need to keep looking. Because burning feet are not a diagnosis, they are a clue. Cause number 5, pressure from your lower back. This one catches people off guard. A patient will say, "Doctor, my foot is burning." So naturally, they believe the foot must be the whole problem. But sometimes, the foot is only where you feel the signal. The source may be in the lower back. Your lower back contains nerves that travel down into your hips, legs, ankles, and feet. If one of those nerves becomes irritated or compressed, the burning may travel down the leg and show up in the foot. This can happen with sciatica, disc problems, spinal narrowing, or long periods of poor sitting posture. Here's the clue. If your burning feet are worse after sitting or mostly on one side, or if you feel pain starting in your back or buttock and traveling down the leg, you should not only treat the foot. You need to think about the nerve path. Think of it like a cable. If the cable is pinched near the wall, the lamp at the other end may flicker. The lamp is not the real problem. The cable is. So what can you do? Notice the pattern. Does sitting make it worse? Does standing make it better? Does lying in one position trigger it? Does the pain travel from the back into the leg? If yes, write that down. Also, avoid sitting too long without movement. Every 30 to 45 minutes, stand up, walk slowly, and gently move your hips and ankles. Do not force aggressive stretches. Your goal is not to twist your back until it cracks. Your goal is to calm the nerve. And here is the warning. If you have new leg weakness, loss of bladder or bowel control, numbness in the groin area, or severe sudden pain, seek medical care quickly. For mild repeated burning, especially if it travels from the back or hip, ask your doctor whether your lower back or sciatic nerve may be involved. Because if the nerve is irritated in the spine, foot cream will not solve it. Cause number 4, skin irritation, sweat, fungus, or dry cracked skin. This may sound simple, but do not underestimate it. Not all burning feet come from deep nerve damage. Sometimes the skin itself is burning. Think about what your feet go through all day. They are inside socks, inside shoes, carrying your body weight, sweating, rubbing, heating up. If your socks trap moisture, your shoes do not breathe, or your feet are not dried properly after bathing, the skin can become irritated, and irritated skin can burn. It can itch, it can sting, it can crack, it can peel. And at night, when you finally lie down, that irritation can feel much stronger. Many people make it worse without realizing it. They scratch the skin, then they soak their feet in very hot water, then they apply random strong creams, then they put thick socks over it, and the skin becomes even more irritated. So here is the simple home step. Wash your feet daily with gentle soap. Dry them carefully, especially between the toes. That area should not stay wet. If your feet sweat, change socks. Use breathable socks. Avoid tight socks at night if your feet already feel hot. If your heels or soles are dry, use a gentle moisturizer. But do not pack thick cream between the toes. Moisture trapped between the toes can make fungus worse, and be careful with hot water. Hot water may feel good for a few minutes, but if your nerves or skin are sensitive, it can make burning worse later. Use warm water, not hot water. If you see peeling, cracking, strong itching, rash, bad odor, or white soggy skin between the toes, talk to a pharmacist or doctor. Because if the cause is athlete's foot or skin inflammation, you need the right treatment, not just pain cream. Now pause here for a moment. We have covered daily habits, nutrient issues, lower back nerve pressure, and skin irritation. But the next 3 are more important, because these may point to something deeper inside the body. So do not stop here. Cause number 3, poor circulation. This one can feel confusing, because some people say, "Doctor, my feet burn, but they also feel cold." Or, "My toes are cold, but my soles feel hot." Or, "My feet ache when I walk, but burn when I lie down." That may sound strange, but it can happen. Your feet need steady blood flow. Blood brings oxygen. Blood brings nutrients. Blood helps tissue repair. blood helps nerves function. When blood flow is reduced, the feet may feel painful, cold, heavy, numb, or sometimes burning. Think of blood flow like water moving through a garden hose. If the hose is open, water reaches the garden easily. But if the hose becomes narrowed, bent, or blocked, the garden at the far end begins to suffer. Your feet are the far end, so if blood flow is reduced, your feet may complain first. Now listen carefully. Poor circulation is not something to guess about at home. If you have burning feet with leg pain when walking, skin color changes, cold toes, shiny skin, slow healing sores, or one foot that feels much colder than the other, contact a doctor. That needs proper evaluation. At home, one of the best support habits is movement. Your calf muscles act like a pump. Every time you walk, raise your heels, or move your ankles, you help push blood through the lower legs and feet. So every morning, do this for 3 minutes. 10 ankle circles in each direction, 10 gentle calf raises, 10 slow toe raises, then walk around the room. Small movement done daily is better than waiting for one perfect workout that never happens. And if you smoke, this is not a small detail. Smoking can affect blood vessels and oxygen delivery. So if your feet already burn, ache, feel cold, or change color, smoking can make the problem harder to control. Cause number 2, nerve irritation or peripheral neuropathy. This is the classic burning feet feeling. People describe it as burning, tingling, stinging, pins and needles, electric shocks, hot needles, or a strange crawling feeling under the skin. And many times they say, it gets worse at night. That nighttime pattern is important. During the day, your brain is busy. You are walking, talking, cooking, driving, watching television, and doing errands. But at night, when the house becomes quiet, your brain notices every small signal coming from your feet. And if the nerves are irritated, those signals can feel much louder. Think of your nerves like electrical wires. A healthy wire carries a clean signal, but when that wire becomes irritated or damaged, the signal becomes noisy. Your brain may receive a burning message even when nothing hot is touching your foot. That is why nerve pain can feel so strange. The foot may not be injured, the skin may not be burned, but the feeling is real. The nerve is sending the wrong message. Nerve irritation can be connected with blood sugar, vitamin problems, alcohol, pressure on nerves, or circulation issues. This is why you should not only ask, how do I stop the burning? You should also ask, why are my nerves irritated in the first place? Before bed, sit on the edge of your bed, point your toes down, pull them back up, make slow ankle circles, then gently massage the soles of your feet. Do this for 2 to 3 minutes. Do not press hard. Do not attack the pain. Just gently wake up the blood flow and calm the nerves. Also avoid very hot water. When nerves are sensitive, extreme heat can make symptoms worse. If the burning comes with numbness, loss of balance, weakness, or symptoms that keep spreading, talk to your doctor, because nerve symptoms deserve proper attention. Now we are at cause number 1, and this is the one I do not want you to miss, because many people with burning feet keep buying creams, changing socks, soaking their feet, and blaming age, while the real problem may be happening silently in their blood. Cause number 1, high blood sugar or diabetes-related nerve stress. This is the cause many older adults ignore the longest, because they say, I would know if I had diabetes, or my blood sugar was fine a few years ago, or I do not eat that much sugar. But high blood sugar does not always announce itself loudly. Sometimes it affects the smallest nerves and blood vessels first. And where are many of those small nerves and blood vessels? In your feet. Your feet are far from your heart. They rely on tiny blood vessels. They rely on delicate nerve endings. When blood sugar stays higher than it should over time, those nerves and vessels can become stressed. And one of the feelings people may notice is burning. Not always, not in everyone, but often enough that repeated burning feet should make you ask one serious question. When was the last time I checked my blood sugar? A simple A1C blood test can help your doctor understand your average blood sugar over the past few months, And if you are over 50, or you have belly weight, family history of diabetes, frequent urination, unusual thirst, slow healing cuts, numbness, or burning feet at night, do not wait until symptoms become severe. The home step here is simple. After dinner, take a 10 to 15-minute gentle walk. Not a hard workout, not a jog, just a steady walk. Your muscles use sugar when you move. Even a short walk after meals can support better blood sugar control. Also, add more fiber to your meals. Vegetables, beans, oats, lentils, chia seeds, simple foods. Fiber slows how quickly sugar enters the bloodstream, and for many older adults, that one change can make the body feel more stable. Now listen closely. If your burning feet also come with numbness, slow healing wounds, tingling that keeps spreading, or you already have diabetes or prediabetes, please do not keep guessing. Call your doctor. Ask about blood sugar testing. Ask whether your nerves and circulation should be checked, because the earlier you understand the cause, the better chance you have to protect your feet. Now let's bring this together. Burning feet at night can feel scary. When the lights are off and the house is quiet, that burning can feel bigger. It can make you anxious. It can make you dread bedtime. But the answer is not to panic. The answer is to observe, write it down, and take the right next step. Tonight, before you go to bed, do a simple 60-second foot check. Look at both feet. Look at the soles. Look between the toes. Look at the heels. Look at the toenails. Look for redness, cracks, peeling, swelling, color changes, cuts, blisters, or wounds. Then ask yourself 5 questions. Number 1, is the burning in one foot or both feet? Number 2, does it come with numbness or tingling? Number 3, is there back pain or pain traveling down the leg? Number 4, do my feet look red, cracked, sweaty, or irritated? Number 5, when was my last blood sugar test? These questions matter because the right solution depends on the cause. If it is skin irritation, you need skin care. If it is blood sugar, you need testing and a plan. If it is circulation, you need medical evaluation. If it is nerve compression, you may need your back or nerves checked. And if it is a vitamin issue, you need labs, not guessing. This video is for educational purposes only and does not replace medical advice. Call your doctor if the burning is getting worse, if you have numbness, if you have a wound that is not healing, if your foot changes color, if one foot is much colder than the other, or if you have diabetes or prediabetes risk. Do not wait until a small symptom becomes a big problem. If this video helped you, share it with someone over 50 who complains about burning feet, tingling, or foot pain at night. And before you go, comment below your location and age. Where are you watching from? I read every comment. And if you want more simple doctor-style explanations like this, subscribe to the channel. I'm Dr. Edward Wright. Stay aware, stay proactive, and take care of your feet.